Hello, dear subscribers. Today is the 29th of July, 2021. And on a regular basis, I am getting articles of CRISPR showing up in my homepage of Google. And this one is dated to yesterday, July 28th, and says CRISPR breaks ground as a one-shot treatment for a rare disease. CRISPR reached a big milestone this year by treating a disease inside the body. Here's what's next for the technology. So they're trying to tell us something, as always, as usual. This is a typical pattern. This is a pattern that keeps on occurring. They tell you about something, but they tell you that it's elsewhere. Or they tell you it's dated to another time. All right? In this instance, they're trying to tell you that it's for a rare disease, but they're using it for something that is being rolled out globally right now. Because this is a cheap technology to use and readily available. And it has, as it says here, it can be injected as one single shot, or perhaps two, or three. Who knows? This is a reoccurring theme, such as when NASA came across the solar system, the TRAPPIST-1, if you may recall, and it was a solar system that's identical to ours, but they said that it's light years away. Whereas it is very suspicious that this solar system is not light years away. It's probably in the region of our neighborhood. And this is the same with what they're saying here. I shall be going through this article. I shall be highlighting main points. So if anyone would like to read the entire article, they can pause and stop the article. It's been nearly a decade since a pair of biologists discovered CRISPR, the gene editing technology that allows scientists to edit DNA with relative ease and with low cost. Last year, the two scientists, Doudna and Charpentier, shared a Nobel Prize for their work. Since the discovery, scientists around the world have been investigating how the method could be used as a treatment for diseases from sickle cell anemia to HIV. But what if I told you that this is being used globally, now as we speak, in an experiment that involves 7.9 billion? So keep that in mind as we go through this article, that it's being used right now in real time. So until now, let's remove this from here. Excuse me about that. Until now, scientists have used CRISPR to treat diseases. By removing some of a person's cells and applying the gene editing technology to the cells in a lab. And that is called in vitro technology, in a lab, in a petri dish. In the case of sickle cell anemia, for example, where red blood cells became misshapen and failed to function properly, doctors will remove cells from hematopoietic stem cells, which will eventually turn into red blood cells and other blood cells. They then apply the gene editing technology to those cells, which make changes to address the genetic defect causing the faulty blood, and insert the cells back into the body. Remember, they don't care about our health, but they do care about DEPOPULATION. But over the past few years, researchers have been experimenting with a new tactic, injecting the DNA editing tech directly into the bloodstream. And indeed, this is being done by injecting that shot into the deltoid muscle, the muscle of the shoulder, and it's been found that shot does not remain there in the muscle, but only 25% of it remains there from pharmacodynamic studies and pharmacokinetic studies. And the rest enters the blood circulation. Okay, 75%. So injecting the tech directly into the bloodstream. This method has several advantages, including the ability to treat a wider range of diseases with more ease and less cost. At the same time, researchers are taking pause, noting that this new method brings risks, including mistakenly editing healthy genes without a good way to stop it. So this is the first parallel that we are going to draw from this article to what is currently happening on a global scale. Number one. So I think we definitely need to be cautious about any new technology, says this Chinese associate professor of biomedical engineering at Tufts University. At the same time, he says there should be a willingness to move the technology forward. No doubt, there's a rush, in fact. In a small 6-person study, which is barely a pilot study, published in the New England Journal of Medicine last month, researchers attempted to treat 6 people with a rare genetic disease called transthyretin amyloidosis with a new technology that delivers CRISPR directly to the cells in the liver. And this disease causes a defective protein called amyloid to build up in the body, resulting in progressive nerve damage and, in many cases, heart failure from cardiomyopathy, which is due to the amyloid buildup. Symptoms can start as early as the late 20s, as RDs is very typical of these rare genetic diseases. And the disease is typically fatal to 12 years after symptoms begin. So we have the second parallel here that delivers CRISPR directly to cells in the liver. It's been shown in that one of the companies that are producing one of the shots globally, I will not say the name, begins with a P, that the you know what are and the rest NA in the mice is delivered to their liver, whereby the CRISPR reaches the liver so that it can do its splicing that's needed. And it says the study is the first part of an early clinical trial of a drug called, and this is the drug listed, which packages CRISPR technology inside a tiny blob called the lipid you know what. And this is the third parallel that can be drawn to what's happening concurrently in real time globally. The containers ferry the gene editing technology to the liver. Okay, it's happening, folks. It's happening right now. People are lining up for this and they don't know what's happening. Okay, where almost all transthyretin, the defective protein is produced. There, the CRISPR tech goes to work correcting the defective cells until the liver produces the correct version of transthyretin. The primary goal of the study was to examine the safety of the treatment, but because the excess amyloid causes the symptoms associated with the disease and a reduction in symptoms seen during the experimental trial hints that the treatment is working. The participants were divided into two groups. 3 people who got a lower dose of the CRISPR-infused lipid, nano, you know what, and 3 people who got a slightly higher dose. And this is the fourth parallel, folks. This is the fourth parallel. This is a dose-finding study. Do you understand? It's a dose-finding study where they are trying to determine which of the 3 doses, because in this small pilot study, they're using 2 doses, a lower and a higher dose. But in the global study, do you understand? They have 3 doses, a small dose, a medium dose, and a high dose, and they're trying to determine which is the appropriate dose to be used. So what is being rolled out right now is a dosing study. You see, that's the fourth parallel. For those who received the lower dose, the amount of defective liver cells decreased by about half, and those in the higher dose group saw a nearly 90% reduction in faulty cells. But of course, with the higher dose, higher risks, higher side you-know-what effects would be the result. So, if you know people who received the lower dose, they probably had minimal adverse you-know-what events. Whereas those on the higher who received the higher dose would have had the serious side you-know-what effects, or even possibly bit the dust in the experiment. The study is still ongoing. Of course it is. It's ongoing, it's global. Researchers will continue to test even higher doses. Of course they are. They are doing so right now. And we're seeing the results of the drug to see which is the most safe and effective. They will also follow all the participants for 2 years. Yes, they are doing so in real time till the year 2023. Right? And the study started at the beginning of this year. Yes, that's your fifth parallel, okay? They're following people. Okay? For 2 years. I just couldn't believe the amount of parallels that are listed here in this study. They are trying to tell you what they are doing. All they do, they just change the names to put you off track. The treatment to watch for any long-term effects, like cancers or other genetic conditions. Sure, those are expected to occur. All right, not just cancers, but also sterility in the process. And also these genetic alterations would be passed on to offspring, if there are any, that is. That could be caused by accidental gene changes. These effects are a particular concern with CRISPR to understand why it's helpful to know a little bit more about how the technology works. And it says a shot in the dark. Oh yes, definitely. Because CRISPR stands for clustered, regularly interspaced, short palindromic repeats. Bacteria contain short, repeating genetic sequences throughout their genes. I spent 2 years of my training being given such sequences, such genetic sequences, and then I would try and establish where the short palindromic repeats were in the sequence. Between these segments, bacteria store the genetic sequences of viruses that previously infected the organism. By keeping the bits of the invading microorganism, the infected bacteria can remember and attack viruses with these genes by cutting them up when they attack again. A protein called Cas9, where Cas stands for CRISPR associated, is responsible for cutting up the genetic material of invading viruses. So this is being used now for cutting up the genetic material of unsuspecting guinea pigs. When studying this system, these scientists realized that by altering the biological guide, the protein used, they could get the Cas9 protein to make a cut in DNA anywhere they wanted in the genome. so that any genes could be deactivated or new ones inserted. And they're telling you once again what they are doing right now in this global experiment. So they could be deactivating genes, and they could be inserting new ones. So though gene editing already existed before CRISPR, the new technology was vastly easier to implement, and in comparison to earlier techniques is far cheaper, but it also has limitations. CRISPR technology cannot tolerate non-exact sequences, says the scientist. That means that it can have what's called off-target effects. It can edit sequences that are nearly but not exactly identical to the faulty genes the tech is designed to correct. That can have serious consequences. And in fact, we're seeing this. And we are soon to see much more over the next decade. For example, a genetic mutation could mistakenly instruct cells to uncontrollably divide, causing carcinogenesis. This potential for harm complicates one of the main benefits of the new technology, which is that enables CRISPR to reach all or most liver cells. And in fact, in a pharmacokinetic study of this thing, the shot that's being rolled out right now, one of the organs that showed where the drug was concentrating was the liver. Okay. Another organ, in fact, the organ that seemed to be highly targeted were the ovaries, and then it was followed by the liver, spleen, and bone marrow, and the sweat glands. And sweat glands, what do they do in this heat, in a heat wave? Well, they sweat. But if sweat glands are expressing a gene and expressing a protein, secreting a protein, well, that protein, you know what protein I'm talking about, from that VIRUS, and it has an SPIKE, all right? That protein then will be shed. It will be excreted through the sweat. And that's how these shots spread. Self-spreading shots designed to spread from one person to another. That's not fantasy, folks. That's happening now in real time. So this Chinese scientist is saying, on the other hand, when the scientists use CRISPR outside of the body, they can sequence genomes to detect any rogue editing. But when the editing happens in the body, as what is happening now, they have no way of knowing if something went wrong, because it may target, okay, it may target a sequence that is not exactly symmetrical. The researchers in this study did take precautions to avoid off-target effects. In preclinical testing on human liver cells, they used a computer program to identify areas at risk for being incorrectly targeted by CRISPR. They found that all of the areas were in non-coding regions of the genome. As far as scientists can tell, the sequences of DNA don't do anything, what is called junk DNA. Even so, when they examined these areas in a sample of human liver cells in a petri dish in a lab, they didn't find any off-target effects. So I'm sure that such a pilot study on small people may have been done in vitro before they went on to do the clinical phase 3 trial, the global trial that's being conducted right now. So, and says that not everyone is convinced that the technology will always yield no consequences. Of course not. It's fraught with consequences that will have long-lasting effects. It's a shot in the dark. We don't know what's going to happen, certainly. The future of CRISPR. This new advance follows nearly a decade of scientists exploring new therapeutic uses for CRISPR. In 2019, CRISPR was tested for the first time on a woman with sickle cell disease. And last year, scientists injected CRISPR directly into the body for the first time, into the eye, to test a treatment for a rare genetic condition that causes blindness. An HIV treatment involving CRISPR also seemed to be successful when tested on mice, though it hasn't yet been tested in people. There are immunotherapy treatments being tested that utilize CRISPR to modify immune cells so that they can better attack cancer. I'm telling you, folks, this is being used now, globally, on everybody. What they are giving to everybody right now is not what they're saying. What they're giving right now to everybody is what we're reading here. So these other two scientists see the new technology as a breakthrough. And although they acknowledge that there are always risks with gene editing, think it might be applied to other diseases that impact liver cells in the future. And says here it's speaking about the trial with the pharmaceutical company Regeneron has already created an altered version of the drug for a hereditary angioedema. And the scientist still has reservations about the potential of the new method, because as we said, CRISPR can have potentially harmful off-target effects. He doesn't see it being widely used in the future in the same way that it was used in the study. Instead, he suspects CRISPR will continue to be used mainly as it has been, editing genes when cells are outside the body. He also sees more promise in other gene editing approach with less off-target editing. But that is what we are being led to think. These people don't care about us. All they care is about money, money, money. If we can use CRISPR to treat those diseases, it can actually bring great benefit to society. That is always their mantra that they keep coming forth with. You see? That's how they will justify more shots. Even more shots in the dark. And finally, judgment is coming for those merchants who practice sorcery. Translated into Greek is pharmakia, Revelation, chapter 21, verse 8. But the fearful and unbelieving, and the abominable, and murderers, and warmongers, and sorcerers, and idolaters, and all liars shall have their part in the lake which burneth with fire and brimstone, which is the second death. You see, folks, this global experiment with all the demise that it's occurring, and the millions of adverse, events, is unsustainable. There are going to be large cracks in that pharmaceutical corporation, giant. It's going to come crashing to the ground. It's going to be destroyed. It's going to be eliminated. I believe in our lifetime, even possibly so in our decade. I hope you found this useful. Please share this article so people realize, especially share it with those who haven't lined up for the global experiment, so they understand what they are about to receive. God bless you all.